doctor when my ears are playing tricks on me. Sometimes I think people are calling my name when I'm playing and no one's calling my name. And sometimes I think someone's knocking, but no one's knocking. Nice dream.
That's my daughter. There we go. That's better. Hello, hello. All right, let me turn this on real quick. Comments. Okay. All right. Hello, everybody. My name is Brooke Harper. I am the nurse practitioner and co-owner of Port St. Lucie Medical Wellness. And every Monday I get on here and do a live at 7:30, just answering questions that anybody has and just going over any specials we have or anything going on, any updates with the clinic. So I'll go over this month's specials to begin with. So the March specials, we have a Sculptra package of 3 for $14.97. They're usually $6.99 per vial, so this is saving you a couple $100 per vial. So what we do, I do usually at least 2 treatments, sometimes 3. We do 1 vial on either side of the face, both sides of the face, so that's 2 vials in the first sitting. And then you wait about 4 to 6 weeks, and then if you need to, we do another vial. Usually most people want to do that 3rd vial. And then after that, you kind of just, you kind of just let it do its thing. It's a biostimulating agent. It's under the classification of fillers, but it is a biostimulator. And it's going to help you produce your own collagen and elastin. So the other thing we have is 3 bio-repeal treatments. So the bio-repeal is a Florida Safe peel. It's not as strong as some of the other peels where your skin is actually just like sloughing off afterwards. It's a little bit more gentle, but it is still effective against like acne, fine lines and wrinkles, acne scars, hyperpigmentation, sunspots, those kinds of things. And we usually recommend a series of 3, 1 every month for 3 months. And right now that is $4.47 for the package of 3. And then we have a resurfix treatment. That's with the laser. My esthetician, Michelle, does that treatment. And it's exactly like it sounds. So it resurfaces the first outer layer or a couple layers of skin with the laser. It does require you to be out of the sun for 2 weeks before and 2 weeks after, and none of these, you shouldn't be on any antibiotics or blood thinners or anything like that. But we'll ask you all that when you come in. Of course, we have the microneedling with RF. This is a new device for us, but we're doing a model call for that. So usually those treatments are $700 each, and we do the face, you can do the neck, you can do the arms, the stomach, anywhere you think you need some like skin tightening, it will help with. So it's going to help promote collagen and elastin. It's just creating this micro trauma with those needles to help promote that growth. And again, we recommend 3 treatments, 1 treatment a month for 3 months. And that's usually, like I said, $700 a treatment, but right now we're doing the 3 treatments for $891. So being that it's a model call, the only thing we ask of you is that we can take before and after pictures, and anybody who's willing interview you and kind of just get your feedback on how it is and let us show your pictures on social media. So that's the hang up with that one. We have new patient specials. Botox is 20 units for $179. Dysport is the first 60 units for $4 per unit. After that, it's $5 a unit. We always have our membership option, so that's $129 a month. You get a couple different things for free that come with it every month. So we have the IV, you can do an IV treatment. You get a free B12 vitamin injection, or you can do a IPL photofacial, which is good for hyperpigmentation, fine lines, that kinds of stuff. And some people do those every month just to kind of keep the hyperpigmentation at bay, because we're in Florida and lots of people are out in the sun a lot. So those freckles and stuff will have a tendency to come back pretty quick with people here. That is tailorable. So if you are looking to do something else, like a microdermabrasion every month for free, then we can tailor those services based upon what your needs are. It's $129 a month. However, if you don't use your free service for that month, you don't lose that $129. It stays on your account, and so you come back the next month, you can apply that $129 towards any service that you're getting. So you don't lose that money when you pay it. Hello. Whoops. Let's see. You also get Botox at a discounted rate. It's $9 a unit. Dysport is $4 a unit, and Xeomin is $8 a unit. So that's a discount for members. Anything else you purchase above and beyond is 15% off. So any products or services. So we carry the Elastin product line, so you get 15% off of that. Or any other services like the M-Sculpt or anything like that, you'll get 15% off. I think that's all I have for now. There was something else I wanted to talk to you guys about, and now I can't remember. I can't remember. I do have Rachel here. Rachel, are you still here? So Rachel won a free microneedling with radio frequency during one of my lives, and I just did it for her last week, and I was going to see if... Oh, she's here. I was going to see if she would be so kind to kind of talk to us about it. So let's see. I'm going to click her in and see if this works. Hey, there she is.
That's bad light. I'm sorry.
It's okay. I'm going to turn you this way so everybody can see you.
Yeah, everybody see me. I didn't put an ounce of makeup on today, so...
Well, Rachel's beautiful, so she doesn't need it. So when did we do your treatment, Rachel?
It was Saturday.
Saturday, that's right. Okay. I can't remember, all my days run together. How are you feeling now, a couple days later?
I don't even feel like I had anything done.
Okay.
So, kind of just waiting for it to do its thing.
Was your skin pretty red for...
It was red for just one day, just Sunday.
Okay. Oh, okay. All right. Is it tender or swollen at all? Do you notice a little bit of swelling? No? Okay.
Not at all. I noticed like a couple of, you can still see a couple of blood marks here. Of course, it's not in this lighting, but other than that, you really can't tell I had it.
Nice. So now we just wait and see what happens.
And it wasn't painful, only around the lips.
Yeah. Other than that, we did her whole face, her nose, her forehead, around her eyes, everything. So around the lip is a little spicy, but other than that, you were okay?
Yes.
Nice. Cool. Thank you.
Of course.
So we'll have to get you back in 4 to 6 weeks and do another one.
Yeah,
Yep.
I want to see what happens after the third one.
Yeah.
And then you got the pictures, so.
Yep. We did take before pictures of her, so once we do her 3 treatments, I'll update those. Well, thank you, Rachel.
Of course.
Have a good night.
You too.
All right, bye-bye.
I don't know how to hang up.
I don't either. Let's see. You're just gonna have to hang out.
Okay.
Oh, here we go. I can do it. Okay, bye. All right. Hello, everybody. Okay, so that was Rachel. So she did the microneedling with radio frequency. Again, that's to promote collagen stimulation and elastin stimulation. That's going to help tighten the skin as well as give you some more bounciness to the skin with that collagen enhancement. That is a treatment I recommend 3 of those once a month for 3 months and to get the best benefit from it. I also recommend that 2 weeks before and 2 weeks after you limit your intake of NSAIDs, and that goes for a couple of the things I do. I do PRP treatments, so I do PRP for skin enhancement. I do it for hair regrowth, and I do it for joint pain. So anytime you're doing anything that's kind of the regenerative medicine, like Sculptra, PRP, PRF, or the microneedling with RF, I recommend that you stay away from NSAIDs. So 2 weeks before and 2 weeks after. So NSAIDs are non-steroidal anti-inflammatory medications. So that includes ibuprofen, Aleve, Advil, and aspirin. If you need something for pain, not because of my procedure, but something for pain that is from something else, you could take Tylenol. So, and that just helps you to get the most benefit out of it. So it's an anti-inflammatory, and that kind of tampers down your body's response to the treatment that we did, because it by nature is anti-inflammatory and we want that inflammatory response to happen. So we get the most out of the treatment and the most stimulation of the collagen and elastin that we can get. So that being said, does anybody have any questions? Let's see. Hey, there's Victoria. How are you? I feel like I just saw you. All right, guys, that's all I got for today. Short and sweet. Looks like some bad weather is rolling in, so if you're in that path, I'll be thinking of you and praying for you guys, and stay safe. Otherwise, I will see you next Monday at 7:30. I can't get that to shut off. You're welcome, Victoria. I love you too. Look, Liam.
What's that?
It's you. 10 years ago. You're a month old.
There's absolutely zero weather coming in.
Oh, really?
It's all past.
It is?
Yeah, that's what
Yeah.
Oh.
You can see the sun setting over here.
Oh, well. Everybody be safe anyways.